Well, hi. Well, it looks like we're here today with a couple of friends. John and I are friends and neighbors, and John is the founder and CEO of, I want to get his title exactly right here, the Health Insurance Specialist, and it's located here in Superior, Colorado. So howdy, John. How you doing?
Howdy, Alan. I am maintaining well,
Good.
doing what we gotta all do in these times to stay healthy and happy.
There you go. Well, talking about health, then let's jump right into it. I would say if there's one place that we could start today, it would, surprisingly enough, it's not going to be hand washing. I think hand washing is great and important. All of us heard a lot about that. But what we don't hear stressed so much is the importance of air. Um, I sent it out an email a couple of days ago, and in that email, I referenced a really famous air war because I think we are in an air war right now, and how we come out of this COVID-19 thing is going to be essentially the result of an air war. How we deal with why is it an air war? It's an airborne contaminant, right? It's an airborne pathogen. um, and washing your hands is great and essential, but that doesn't address the issues of air and what happens to you and your body as you interact with air. So I had referred to the Battle of Britain, which was a very historic battle in which the Royal Air Force beat the Luftwaffe, the German Air Force, and saved Great Britain. And so I don't know, maybe we could all consider ourselves air warriors or something to that effect. And how do we apply that? Well, I'd like to hand it back to you, John, because you had enough insight actually before the virus hit to do some things about your air quality, meaning the air that you are breathing right where you're sitting right now.
Yeah, for sure. Well, thank you, Alan. And in case you missed it, folks, my last name is Lazes. So I'm John Lazes, Lazas, with the Health Insurance Specialist. And I have spent the last 25 or so years practicing natural health, holistic healing, natural nutrition. And with that has come research and attention in the areas of water quality and air quality. And albeit informal research, but a lot of it has served me very well over the years. And so what I decided to do a few months ago was to, first of all, have my furnace filter changed. And then I got to thinking, well, I live in this place where I don't know how long ago the ventilation system was cleaned, or how often it's been cleaned. And then since it's a rental unit, I decided probably not very often and probably not, maybe not ever. Okay, so I decided, well, if I'm replacing the filter, why not get the ventilation system clean? Because after all, the air coming out of the filter, even if it's a great filter, that air is still passing through vents and passageways that if they're clogged with debris and pathogens and dust and all that, the air gets contaminated again before it enters the room that you're sleeping in, let's say. So I enlisted the help of a service to get those vents cleaned, and they got cleaned very thoroughly. And so that was one measure I took. And then even more recently, I decided to get a room filter, a stand-up filter, to further filter the air while I was sleeping in particular. And then it's portable, so I can move it to my work area, my home office area during the day. And this unit has a HEPA filter in it. And for those of you who don't know, HEPA filters are one of the more thorough filters you can use to clean your air, your ambient air in your space. So I employed those two methods. And then, speaking to Alan just the other day, Alan helped me to realize that there's even more that I can do and that we can all do to ensure clean air in our space. And again, it's important in general to have and to be breathing clean air, purified air, but especially in these times because of the current situation we're facing. So with that, I'll hand it back over to you, Alan, and let you enhance and build on what I just mentioned.
Okay, just all right, segueing from what you just said, yes, it is really important. And people may be wondering, well, what does this have to do with a virus? And are there viruses circulating around in your apartment or my home, wherever they're living? And hopefully not, at least hopefully not COVID-19, but actually there can be quite a number of pathogens in the air that we breathe in our homes. And just to get right to the point about COVID-19, we need to maintain as much health. We need to strengthen our immune systems as much as we can to resist whatever may come at us. And the way we breathe and what we breathe is one of the primary things. And so if you are breathing stuff that is really weakening you, subjecting you to perhaps other illnesses, not necessarily the coronavirus, but it is going to make you less resistant. Does that set a good context for what you did in cleaning up your air?
Yeah, for sure. And it's about dust. It's about pathogens in the space. It's also about common household items that create indoor pollution,
Yeah.
indoor air pollution. So many years ago, I started to clean that piece up as well, and throughout got rid of the commercial products that are known to create bad air quality indoors, and start to go with some of the more natural products that don't off gas and don't create this indoor situation. So there's that piece too. But
that's a really good piece. May I make a comment on that?
Yeah. Mm-hmm.
I think that is really, really essential as we're sharing our experience with, again, what we're doing for us. People will do, they'll listen to us or not listen to us and hopefully do their own research and make their own decisions. But I too have been really concerned about, what is in the air and what we're breathing in, and have been for a long time, like yourself. And one thing I do not use anymore is I do not use any of those. I'm not sure, they sometimes go by the name of air fresheners, but they're fundamentally artificial smells, artificial perfumes, or whatever you want to call them, that actually, some of them are actually neurotoxins. They, some
Right.
research.
And they mask odors. They don't eliminate them or neutralize them.
Exactly, they mask them, and so it can be, it can be tolerable for some adults to breathe them. Tolerable, not necessarily healthy. But if you've got pets, animals, if you've got kids, especially infants, they're bringing that in. That can really bring their resistance down. So I would say just learn to accept the fact that your nose can be a warning device, and is there actually, it is a fairly big warning device to let you know what smells off in your environment, or is there a moldy smell? Is there a toxic smell, so that you can address it right away instead of just saying, the air smells so sweet in here. But it's
so I think
it's a funny sweet.
Starting there with indoor air quality is getting at the root of the situation, right? Like creating a home environment that is that enhances the air quality as much as possible, contributes to the health of the air quality. Another idea is indoor plants. I've actually been getting more indoor plants just because I love them and I love the life that they bring into my space. But a lot of these plants are known to take toxins and pollutants out of the air.
Absolutely. Absolutely.
So,
Like sort of like living a little bit in your own forest or something.
Yeah. And so starting there, and then after you've cleaned up the environment from that level, then you can employ or maybe simultaneously you can employ the filtration systems and the filters and such. Would you say just a bit about the special filter you put in your furnace recently,
Oh,
Alan?
oh yeah, I'd like to talk about that. I put in a MERV 13 filter. And the reason I did that is I did a little bit of research, and from what I read, that's the highest filtration, highest quality filter you can have in your home forced air heating system or central air conditioning system to get out the smallest possible particles and still not hinder the air circulation, because most of the air circulation systems, central air conditioning or forced hot air, they have a fan in there. That's what makes the air circulate around. And if you put too much back pressure on that fan, it can cause your fan to eventually burn out. Of course, you don't want to do that. So yeah, I that was my thing. I got that filter, and then I think another thing that we haven't touched on here yet is humidity. And I was very much aware of the issue of humidity. I'd done some research on it, and anyhow, what I've come up with, again, people can do their own research and check it out. But what I've come up with is that based on some pretty substantial and respected research, that a humidity range of between 40 and 70% is the humidity level, which actually inhibits, or at least does not promote, the proliferation of pathogens. And that surprised me when I first learned it, because I'd always thought before that, well, hey, the drier the air, the better, because if the air is really dry, those organisms are not going to live in it. And as it turns out, the research convinced me that actually, if you get it too dry, it can be dangerous just as well as if you get it too high. We all realize that if you get your humidity too high, things can get moldy. You can get mold and mildew growing. But there's that sweet spot in there. And so I'd like to situate this, since we don't have a whole lot of time. People need to get on with their lives and learn what they can from this, and then maybe apply it, or maybe go take care of something else. But we're talking right here and now. You and I have in our living space, we have what's called HVAC, heating, ventilation, and air conditioning system. It goes by that acronym, HVAC, and that's what you and I have. Now, some people do not have that type of heating and air conditioning system. They may have window air conditioners, which is a totally different thing. Or they may have, for heating, they may have some sort of radiant heating system. And if you have a radiant heating system, oh, well, you are really in good shape, much better shape in general than these air circulating systems. So you don't have to worry about the whole issues of filtering and cleaning out ductwork and that, but one still needs to be concerned about maintaining the proper humidity level, and then scrubbing the air as well as you can, disinfecting it if you wish. I'm not talking about putting chlorine in the air, no thank you, but that killed a lot of people in World War I. Don't want to do that again. But yeah, so I just want to set it in that context. Does that make sense, John?
Yeah, for sure. And looks like we have maybe a couple or so minutes left, Alan. So I wanted to segue. This is the perfect point to do this, I think, to common spaces. And a lot is being said, as you and I have talked about making sure surfaces are disinfected to protect us against this virus, washing our hands, all that sort of thing. And as you and I have agreed and observed, not a lot is being said about the air quality in these spaces. So, and many common spaces are being closed. And so the air quality wherever we can still go, the supermarket, okay, the gas station, of course, outdoors, it's going to typically be better, especially because
for sure.
Less people are driving these days. I think the air quality is a bit better. But let's take doctor's offices. Let's take hospitals. Let's take urgent care centers, okay? There are some of us who are still going to need these services, and maybe even more so coming up, okay? And there's no doubt that we can't escape going to an emergency room if it's a life-threatening situation, okay? But I tell people in my practice, why not use urgent care if you don't think it's life-threatening, because urgent care can do a lot that ERs can do for a fraction of the price. But even so, going into an urgent care, let's say, we may be potentially exposing ourselves to the coronavirus and other pathogens, other bacteria and such that may not be so good for us in general, and especially now.
Yeah.
So
well, I think that you, based on the conversations you and I've had, there's an option that you actually had talked to me about, and I've sort of used it from a different angle. But what do you suggest for not having to go to those places? What's your solution?
Yeah, for sure. Well, fortunately, the field of medicine has been developing this alternative for a while, becoming more and more popular even before the coronavirus started gaining headway. And it's sometimes called telemedicine and sometimes called virtual doctor visits. So the idea is that the individual has access to these services through some health insurance policies that include the service, or if not, through they can purchase a supplement that can give them access to these services and other benefits as well.
And that supplement you mentioned, I would imagine that's a fraction of the cost of a full-blown insurance coverage.
Oh, for sure it is. And every insurance policy, including the ones that we work with and offer, have their gaps and holes called your expenses that are on you that aren't covered by the health insurance company. Deductible and co-insurance and co-pays are examples.
Yeah.
Okay, so a health supplement, just like a Medicare supplement, I'm sure you can identify, right? You need Medicare supplements to complement the base Medicare coverage and to fill in the gaps and such. And when you turn age 65. So telemedicine, at least the service that our supplement utilizes, works like this. You call an 800 number that is open 24/7, 365. You speak with an intake person. Usually within 10 minutes, a doctor calls you back. These are board-certified doctors who are licensed to diagnose and prescribe by telephone and by video conference, and they can not treat things, but they can get a little guest arrival there.
Yeah, I think that I'm
Okay.
single dad, and of course the girls are no longer in school, so they need a lot of contact with daddy,
Yeah, well,
during these times.
Yeah, for sure. And Alan, there's probably a lot of people out there listening or who will listen and view this that can identify. So no problem. But
Okay.
but anyway, this service is unlimited, meaning a family can call as many times as they want in a year. Most consultations, again, either done by phone or video conference, are free of charge. Okay, so what does this accomplish in the context of what we've been talking about? Well, first of all, it keeps you away from those potential breeding grounds for coronavirus and other illnesses, and keeps you healthy and safe, hopefully that way, or healthier and safer. And you can get a diagnosis and a prescription, as I said, if need be, this way. If there's other medical advice that the doctor wants to give, like go to an urgent care or get to the ER right away, they'll tell you that. Okay, but at least you got a second opinion beyond your own, that is, as far as what needs to be done. Yeah. And this service is available early morning hours, late hours at night, weekends, holidays, while one is traveling. so on and so forth. They're always there.
Yep.
Okay. So this kind of service helps keep you safe and healthy, saves you time and energy compared to traveling to see a doctor in person, sit in their waiting room, etc.
Yep.
And saves you money because whenever you go to a doctor's office, you have to pay a fee. Sometimes it's a copay, $50 or whatever. Sometimes it's more. Sometimes you have to pay it all. Whereas with this service, you don't have to pay a consultation fee for most types of consultations.
Yeah. For the parents, oops, is my microphone rubbing or something? I'm not sure what's going on. There's a little bit of noise. Okay. Anyhow, pardon me. I
No,
heard.
you're good.
Okay, good. Yeah. I've used it really effectively, that type of service, with my kids, because the pediatrician's office is a place where I can call and ask to talk to a nurse, and sometimes I get to talk directly to the nurse. Sometimes they'll have a nurse call me back in maybe 10 minutes. But wow, it has really saved us some of those trips and allowed me to deal with something with a kid at home. And of course, in this situation, not only do we don't want to be exposing any of our family members to bad air anywhere. Yeah. And so I think that's really important for the kids too, that, the pediatricians, you can talk to a nurse, and the nurse can, in that case, she could say, hey, well, in this case, it sounds like a certain over-the-counter solution might be appropriate for you. And, if things don't get better shortly, well, then come on in. But I really like, too, your distinction that you made between going to the emergency room and going to urgent care, because emergency rooms are, they're part of a hospital. And even before COVID-19, hospitals were generally well known for being places where you could get sick, and it, just logically that makes sense. But even more so if you realize that they generally there have some sort of air circulating system, and that's going to pick up germs from people, and unless it goes through the proper filtration and treatment and all that, it's going to spread germs. So a lot of good reasons to, first of all, John, it reminds me of something I learned when I was a Boy Scout about life saving. I took the life saving merit badge, and if somebody's drowning, you don't jump in the water right away and try to swim out and save them. There was reach, throw, row, go was what we learned as Boy Scouts. And so, if you can reach out to somebody with a pole or something, let them grab hold of it, do that. If you don't have that, and you can row out in a boat, you go out and row out in a little boat and get them. If you have a, lifeline, you can throw them that. And the last option is to go. And I think that you can kind of modify that. And I would just say, in this situation, call, first of all. And then you have to go to an urgent care if there's one available. But ultimately, it's really, really serious. Well, you go to the emergency room. Right?
Yeah, I love that. I love that metaphor. And by the way, the telemedicine service that I work with also has RNs, registered nurses, who actually answer the phone. It's a complimentary service to the doctor service, but
all right, so
RNs
you get a nurse right off the bat. Yeah.
Right off the bat, who can give you medical guidance and advice. Can't prescribe and diagnose, to my knowledge, but anyway, if you need to speak with somebody immediately rather than waiting for a doctor to call back, usually a call back in about 10 minutes, my experience, but then you have that at your disposal. But anyway, if anybody out there in listening land is interested in learning more about how telemedicine might benefit you further, and maybe get some pricing on the different plans that are available, let me know. I am John Lazas, Lazas. My email address is john.lazas@ushadvisors.com. That's john.lazas@ushadvisors.com. And my direct phone number is 303-817-3526. That's 303-817-3526.
Great.
And with that, Alan, do you have any parting shots or closing wisdom?
Yeah, well, coming back to where we started, we're in an air war. And it's good to wash our hands, but we should not let that give us a false sense of security. That is like a minimum thing that we need to do is, wash our hands, keep our hands away from our face, the wisdom that is being passed out regularly. But what we don't hear so often again, and that's one reason we started talking about air, is these measures that you can take in your home to breathe better air right there at home. And then the measures that you put forward, the telemedicine measure, which means that it eliminates you having to go out into public spaces where you may be more likely or even highly likely to come into contact with those with COVID-19. So that's what I would wrap with. And I if I've got maybe a minute, here's what I would do. I in my email that I shared with John a while back, I just put some bullet points there. And I guess this is kind of summarizing what we said. Number one was I replaced the cheapo air filter provided by the landlord with a MERV 13 filter. So we talked about air filtration. I ordered a humidity gauge from Amazon, and using our little humidifier and a pot of simmering water on the stove, I maintain a relative humidity between 40 and 70%. And there, I think some of us are operating on a low budget, and we have to figure out ways to do what we need to do without spending huge amounts of money that we don't have. Mm-hmm. And then when the budget permits, point three, when the budget permits, I will get an air ionizer. Like John, he has an air ionizer and high quality air filter for each room, or at least for his bedroom. And that's one thing I aspire to do. And I mentioned that I'm trying to have our landlord pay for the cleaning of the ductwork, but as John mentioned, that's not what the landlord here does. And finally, this is one thing we didn't touch on, but I said, if I owned my own home, I would have a REME, I think that's pronounced REME Halo system installed. I think that's a trademark, and I'm not necessarily promoting them. But the listeners can do their own research about, I think it's called UVCGI. It's an ultraviolet system that can be added in to either a circulating air system or installed in a room that actually, John, I'm hearing a little bit of static there. Is that something you're hearing?
No, I'm not. I'm not hearing anything.
Okay, great.
It's clear.
Good. Anyhow, listeners can do their research on that, but there are actually systems that one can invest in that will actually kill viruses such as as COVID-19. So that's a step up, and that's not something we're going to jump into in detail here, but just to make folks aware that if they want to do that additional research and look into those options, that's the other next level, I guess, to consider.
Yeah, and Alan, to because kind of restate the disclaimer that lest we run out of time and you forget your disclaimer that you've had on other segments of this show, if you will. You've said, we're not medical doctors, we're not legal advisors, we're not financial advisors, even, although I guess I am in a certain aspect of my business in the health insurance world. But none of this that we have said is designed to be medical advice or to treat or diagnose,
Yep.
Kind of the standard disclaimer.
Exact standard disclaimer. We're sharing our testimony, if you wish, about what we're doing and what we think is important for ourselves. And, if people can learn from that and then, take something we've said and do their own research and decide how they're going to apply it in their lives or not apply it in their lives, then if we can avoid, if we can help avoid one case, help avoid one or two cases, I mean, that's huge. And do that, we're good.
Yeah, and one thing you forgot to mention that I will mention before we go, just very briefly, is we have a built-in filtration system in our noses. And so
let's tackle that one next time. We're just about out of time, but yes, we definitely do.
Okay.
We do, but there's a lot more to say about that. But we have a great system. I agree with you, John.
Onboard filtration system. Yeah, more to come, folks.
Yeah, more to come on that.
Okay, Alan. Great. Great chatting with you.
Likewise. Thank you, John.
Yeah, be well and safe.
Likewise, be well and prosper.
All right.
Bye-bye.